Ashley Beasley. Today I'll be doing an administration medication checkup. So I'm going to start by showing my ID, scanning the room. Once I scan the room, I'll position my camera. I'll be repositioning, touching my camera just to make sure it doesn't die, or not die, but go to sleep. So I'm just waking it up. So just do a little disclaimer. So the first thing that I'm going to do is I'm going to go into my medication room. When I go into my medication room, I'm going to make sure I follow the no interruption zones policy, and meaning limiting conversations with co-workers or colleagues, and making sure I don't take any phone calls or any interruptions, and make sure that that medicine room is closed. So I'm going to start by doing the 5 rights. So I have right patient, Jaguar Jones, right medicine, heparin, right dose, 5,000 units, the right route, subcutaneous, the right time, every 12 hours. In addition to doing my 5 rights, I'm going to do my allergies. On my patient care order form, it says I'm allergic to penicillin, and also on my MAR it says I'm allergic to penicillin. So after I've done that, I perform hand hygiene. After I perform hand hygiene, I'll open my medicine cabinet and take out my heparin, show my heparin, got my heparin. I'll also be taking my TB syringe. But once I'm going to check the expiration date on my heparin, and after I've checked the expiration date, I see that every 5 milliliters is 50,000 units. So I know 5 times, we're giving 5,000, so I know 5 times 5,000 is 25,000. 25,000 divided by 50,000 is 0.5. But before I do anything, I'm gonna just check again. So I have right patient, right medicine, heparin, I have heparin, the right dose, I have 5,000 units, right route, subcutaneous, the right time, it's every 12 hours, and then I'm going to take my alcohol swab, and I'm going to clean the vial. After I've cleaned the vial, I'm going to take my syringe. Sorry, it's already been opened, so take my syringe, I'm going to take it out, and remove the cap. After I remove the cap, I'm going to place it in my package, and I'm going to pull out 0.5 air. So after I pulled out 0.5 of air, also with giving heparin, I need to know that I need to be getting this verified by another nurse as well. So I'm going to press it in, put the air in, flip it over. I'm going to stand back a little bit so you can see what I'm doing. So I'm going to pull back 0.5, and I'm going to just flip out any air bubbles. Come to my camera because it's about to sleep. Still flicking out air bubbles, making sure you can see. So now I've got my dose, I'm gonna take it out. I'm gonna just flake for any extra air bubbles. If I see any, flake, making sure there's no air bubbles, and making sure that I still have my right dose. But if I did not have my right dose, I do know that if I have to go back into my medicine vial, I'll take another alcohol wipe and clean it again. So I have it on 0.5, so I'm just going to show it to the camera that it's on. I'm going to put my camera up a little bit so you can see that it's on 0.5. So 0.5 is right there, it's on 0.5. So now I'm going to scoop my needle, or recap, doing the scooping method. Put it right here, put my hand behind my back, scoop up the needle. Now the needle is covered, take that hand and recap it. So now that it's recapped, doing the scooping method, I'm gonna also take a label. I'm gonna take this label just in case I have to walk out and I forget or something. So I know that it's heparin, I know that it's 5,000 units, and I know that it's given to Jaguar Jones. So after I've done that, I take my MAR and my medicine, and I'm to my patient's room. From the patient's room, knock, arm hand hygiene. For hand hygiene, I do 2 identifiers. So I have my armband, let me move the camera. I have my patient's armband, and I'm going to compare it with my arm. So I have Jaguar Jones, date of birth, August 25th, 1963, August 25th, 1963. The MR number is 417-417-6052-6052. It says allergies, got the allergy band. On the MAR, it says that he's allergic to penicillin, and on his allergy band is also, it says he's allergic to penicillin. I would just ask my patient, just ask the patient, Mr. Jones, are you allergic to anything other than penicillin? And if you come in contact with penicillin, what will happen? And once he tell me, I would just be explain the procedure to him afterwards. And after I explain the procedure to him, I will go in and I will just ask him, after I tell him the procedure, I would put him in a working height, raising the side rails, and I would apply my clean gloves and my goggles. And after I apply my clean gloves and my goggles, I'm gonna go in again and check. And got heparin, 5,000 units, 5,000 units, every 12 hours, every 12 hours for the time, and the right patient, Jaguar Jones. So I'm gonna do that in a better order. Got right patient, Jaguar Jones, right medicine, heparin, right dose, 5,000 units, right route, subcutaneous, every 12 hours. So I would assess the skin for any abrasions or bruises, because when you're giving shots like heparin or insulin, you tend to give them in a region, and you don't want to keep giving that same shot in that same region because that'll hurt. So I will just check and see if he has any bruises and make sure I give it in a spot that hasn't already been given. And when you're giving a subcutaneous shot, you need to go 2 centimeters around the umbilicus, not going above the coastal region or below the pubic, and not going past the anterior superior iliac spine. So once I've done that, I'll take a wipe and I will clean the patient's skin. Going in circular motion. Discard. And right before I give this injection, do my 5 rights one more time. So I got right patient, Jaguar Jones on his armband, right medicine, heparin, right dose, 5,000 units, right route, subcutaneous, and the right time is every 12 hours. And also, if I haven't already stated, before I have given this injection, I have already did some pre-assessments like checking for blood pressure and a pulse. So I remove the cap, pinch the skin, stand going at a 90-degree angle, so straight up and down, slowly injecting medicine. After I've injected the medicine, pull it out, gently apply pressure into my sharp container, place it in there. After I've gently applied the pressure, I would raise him back in a comfortable working position, and raising the side rails. Then I would take off my clean gloves, going from glove to glove and skin to skin. I would perform hand hygiene, and I would assess for any allergic reactions, and I would also document how the patient felt during the procedure, and if after I've documented how he felt, I would also come back a little later and reassess him and see if everything is still good with him and making sure he's okay and hasn't had any type of reaction to the medicine. And this would have completed my administration medication checkup.